Now let's look at German measles or rubella. It's caused by the rubevirus. It often, most often affects adolescents and young adults, and of course it's transmitted by respiratory secretions. There's not really a treatment available, but it is part of the MMR vaccine. Hepatitis C is caused by a flavivirus, and you get it by blood contact, such as blood transfusions or needle sharing by drug abusers. There are varying characteristics for the infection. 75 to 80%, 85% are infected forever. Sometimes the symptoms can be pretty severe and they don't cause any liver damage, but most often they lead to chronic liver disease. And you can also get cancer from the chronic liver disease that they cause. They treat it with interferon and ribavirin to try to control the liver damage. There's no cure and there's no vaccine. Arboviruses are spread by arthropod vectors, like mosquitoes, ticks, flies, and gnats, and there's 400 viruses in all. Most cause illnesses, or most of the illnesses these cause are mild fevers. Some can become severe and cause encephalitis or hemorrhagic fever, which is life-threatening. Vectors and viruses are clustered in the tropics and subtropics, sometimes in the temperate zones. The life cycles of these arboviruses is linked to the ecology of the vectors. When they're actively feeding and reproducing, you're going to see a peak in infections. Humans can be a maintenance reservoir, or they can be the accidental host. And so to control the disease, you have to control the vectors. The general characteristics of these arboviruses, an acute arbovirus infection can cause you to have a mild fever with rash and no long-term side effects. But your prominent symptoms, you're going to have fever, headache, myalgia or muscle pain, joint stiffness, and rash. Viral encephalitis affects your brain and meninges and spinal cord. So there's going to be convulsions and tremor and paralysis, memory deficits, loss of coordination, changes in your speech and personality, and coma. And if you survive, you're going to have permanent brain damage. In the United States, we hear about West Nile virus. It's West Nile virus encephalitis, and it comes from mosquitoes that are infected from bird's blood. 80% of people that have this have no symptoms. Less than 1% will develop either encephalitis or meningitis, which is neurological. The eastern equine encephalitis affects those in eastern United States and Canada. The Zika virus is transmitted by mosquitoes, and it will cause birth defects if the mother's infected during pregnancy and with sexual contact. Now, this chikungunya virus, I've never heard of it until recently. It's hard to even say. The infection started in the Caribbean in 2013, and they would have fever, headache, muscle, joint pain, nausea, vomiting, and a rash. But mortality rarely happened. Then you have hemorrhagic fevers like yellow fever that we no longer have here in the United States. It's transmitted two ways. The urban cycle is transmitted to humans by mosquitoes, and the sylvan cycle is from forest monkeys and mosquitoes in South America. You'll have acute fever, headache, muscle pain. You can have oral hemorrhages, nosebleeds, vomiting, jaundice, and liver and kidney damage, and there's a high mortality rate. Dengue fever is carried by a mosquito, but we don't have it here in the U.S. It's usually a mild infection, but if you get dengue hemorrhagic shock syndrome, which is breakbone fever, you have extreme muscle and joint pain, and it can be fatal. Mosquitoes are involved in more infections than any other arthropod, and the answer here is very obvious even if you had not listened to the lecture.